Last fall, Ontario's COVID-19 Science Advisory Table estimated that 57 to 78,000 people experienced what's called long COVID. That was, as they put it, a conservative estimate. Now, with tens of thousands of new infections in this Omicron wave, presumably that number will rise substantially. With us on the significance of that for patients and the healthcare system, we welcome, at the McMaster University Medical Centre in Hamilton, Ontario, Dr. Konstantinos Chelios, Assistant Professor in the Division of Rheumatology at McMaster University's Department of Medicine. And in Ontario's capital city, Dr. Anna Banerjee, Associate Professor of Pediatrics and Infectious Disease at U of T's Dalla Lana School of Public Health, and Dr. Angela Chung, Senior Scientist at the Toronto General Hospital Research Institute and Professor of Medicine at the University of Toronto. And we thank the three of you off the top here for joining us tonight on TVO for a discussion about something that is too prevalent in our society right now and we need to know more about. But Dr. Chelios, let me just start with you. I don't want to assume everybody knows what long COVID is. So let's start there. What is it?
Thank you so much for having me, Mr. Bacon. I think it's widely acceptable now that we need to follow the World Health Organization definition for long COVID. And they define this, or better to say, post-COVID-19 condition as the persistence of symptoms after an initial infection with COVID-19 that persists beyond 12 weeks, actually, and they last for at least 2 months. These symptoms are mainly fatigue. These patients report that they feel tired all the time. They can be brain fog or mild cognitive impairment, some memory issues. They can be difficulty breathing, particularly on exertion. They can't tolerate exercise so much, and plenty of other symptoms. They have reported at least 200 symptoms up to now to different ethnic populations.
Dr. Chung, let me get you to pick up the story. In the year since you were last with us, what do you know now about long haulers, as they're called, that you didn't know a year ago?
We are learning a lot in terms of what is causing these long haul symptoms. We have some top hypotheses for why people are having these symptoms. Probably the top one is vascular endothelial dysfunction, which means there's a damage to the lining of the blood vessels, and it affects how blood is delivered to various systems. And the second hypothesis is immune dysregulation. So there's a change in the way that our immune system is working, and it may not behaving in the usual way. And then the last hypothesis is really around residual viral particles or residual virus hiding. And those three are the top hypotheses right now. Okay. And there are studies supporting all of these hypotheses.
And let me get you to follow up on that in this regard. Of the total universe of people that get COVID-19 at all, what percentage of them are long haulers?
You know, it's very difficult to estimate, but I think it's between 10 and 50%. So the lower estimate is 10%, which means, you know, like in Canada, we have more than 3 million people who have had COVID. And so 10% would be 300,000 people. And it may be as high as even close to 1 million. The problem is the definition of long COVID. Do you count people who only have one symptom, like loss of smell and taste, and they're not quite back to normal? Or do you only count those who can't go to work and still have debilitating symptoms and can't do the activities of daily living? And so I think, you know, it's the severity of it that makes a difference in terms of the percentage.
And Dr. Banerjee, let me try this with you. Just as with regular COVID-19, if you're a young person, a teenager, the impact of getting COVID-19 is likely to be a lot less than if you're an older person. Is it the same with long COVID?
So we don't really know how many kids have had COVID to begin with. So we don't have a denominator because kids with mild symptoms don't get screened, and sometimes the test can be falsely negative. And again, we have different definitions of what is long COVID. But if you look at the studies, again, it's between 2 and 50% of kids that have a positive test for COVID that end up having long symptoms. So there's we think in general most kids don't get too sick, but there's a small percentage of kids that have debilitating ongoing symptoms.
And I'll follow up with you with this. Would the symptoms, if you're a younger person and you're a long hauler, be the same as if you're an adult?
I think that there are less kids that have symptoms, but the symptoms are similar with the brain fog, the muscle ache, the shortness of breath. But also it depends on, like for adults, they have more comorbidities. They have higher rates of diabetes and things like that. So there may be more impact. But I've seen children, more teenagers than younger kids, that have quite debilitating symptoms, similar to adults.
Dr. Chelios, what's the longest amount of time you've heard of somebody living with long COVID?
I've seen patients actually with symptoms persisting more than 15 to 16 months. I don't know about 2 years, most likely. We had the first cases in Canada, if I'm not mistaken, in February 2020. So I guess we need some time for this. But what I'm saying, Mr. Bacon, in general, because I'm taking care of patients with long COVID here in Hamilton at the St. Joseph's Hospital, is that some of the symptoms may get better with time. For example, fatigue or in this difficulty breathing, some of them feel better with time. In some symptoms like the anxiety, the depression, the non-restorative sleep these people experience is not getting better, at least after 6 months from the start of their follow-up. So we see that this is an issue to these people, and this creates not only anxiety but disability, but the disability when it comes to work. Some of these patients are still on short-term disability, and I'm afraid that we'll need to consider this in the future.
Now, Dr. Chung, let's follow up with this. We've been through Alpha and Delta and now Omicron. If you got long COVID under a different variant, would your symptoms and would the impact be different?
Up to now, they are very similar. Whether Omicron would be similar is still too early to tell because the definition of long COVID is having symptoms greater than 12 weeks. Our first case of Omicron in Canada was on November 22nd, 2020. So we're not even at the 3-month time point yet.
Gotcha. I want to check with all three of you and see whether all three of you, who are experts in your respective fields, whether you all agree on what causes long COVID. We heard some explanation earlier. Dr. Banerjee, what's your assessment of how do you think this happened?
I think that I would agree with Dr. Chung as far as the theories and the hypotheses. I don't think anyone really knows, but I think all those three theories are probable.
Dr. Chelios, how about you?
I will second Dr. Banerjee and Dr. Chang. The only thing I want to add, actually, is that I don't believe that there will be a single explanation on what causes long COVID. We're talking about a constellation of non-specific symptoms. I told you something about more than 200 symptoms. I think it's highly unlikely that we'll come to a single cause of this. Probably something is happening with the immune system in some patients, something is happening with the respiratory muscles, something is happening with with viral particles that persist in the body. I think that we'll come up with different definitions of long COVID, and we'll break it down to different categories that have like different underlying mechanisms.
All right, Dr. Chung, having said that, can you yet determine whether or not it affects different demographics differently? For example, maybe are there more women than men that get it, as an example?
There are definitely more women than men who get long COVID. But men get sicker and they end up in the hospital more and they have a high mortality rate. So, whether women survived it better and then they get there are higher number of women getting long COVID, but that's definitely true that we're seeing more women with long COVID.
And do you have a theory as to why it affects more women, but it affects men more strenuously?
There are many theories again. One is a sex hormone difference because women have estrogen, and there are changes in hormones over cycles in the younger in the menopause sort of. With menstruation. So that's one piece. The second piece is that our immune system is different. So I like to say that every cell in our body is sexed. The behavior of the cells, it can be different. And we know we have data supporting that our immune system behaves differently between men and women.
Dr. Banerjee, can you predict who will get long COVID and who is less likely to get it?
So someone with severe symptoms, like for example, a child who's hospitalized with severe COVID and has, multi-system inflammatory syndrome, or is hospitalized with more significant symptoms, they have a higher risk of having longer symptoms. But most of the people that get long COVID, and talking about children, are healthy. But when you look at some of the studies, you look at some of the predisposing factors, and different studies have different findings. But type 2 diabetes, pre-existing health conditions like obesity, asthma, there seems to be a link, especially in children, being female, being older in age. So it's just some of the risks. And for children, again, asthma and potentially allergies.
Dr. Chelios, can you let us in on some of the research that you're doing at McMaster University right now on this? Maybe take us behind the scenes. What's your hypothesis?
Thank you so much for the opportunity to talk about this, and I would like to acknowledge my research team. I'm working with doctors McMaster and Spenningson at the St. Joseph's Hospital here in Hamilton. What we're looking at is the involvement, the role of the immune system and autoimmunity actually in the pathogenesis of the long COVID syndrome. And we base this on our observations that in patients with more severe disease, that Dr. Banerjee commented on the severity of the initial disease, patients who were admitted in the ICU, for example, had a more excessive activation of the immune system and more autoantibodies in their blood. And patients who recovered at home did not have that much of an immune activation. And we base our hypothesis on this. What we have seen up to now is that patients with long COVID have some more activated immune system, and some of them, I won't give you a percentage that because we're talking about like a small sample of 30 patients that we have saved. Some of them develop full-blown autoimmune diseases, and I would like to stress this. I'm an autoimmunity expert. There have been about 50 cases worldwide with autoimmune diseases appearing being diagnosed after COVID infection. And I think that we'll see more in the near future. We may expect like a surge in systemic autoimmune disease in the near future. So, not only in Canada, but worldwide.
Okay, let me do a quick follow-up on that. If you get long COVID then, Dr. Chelios, is it likely that you will then experience other autoimmune diseases as well?
We don't have the data to say that with confidence. What I'm saying is that some of them, if you want me to, I can give you like a 10%, close to 10%, but anyway, some of them develop systemic autoimmune disease in the form of rheumatoid arthritis or polymyalgia or even systemic lupus erythematosus.
Dr. Chung, are there other viruses that can lead to the same kind of symptoms that people with long COVID demonstrate?
We do know that there are other viruses that can have long-term symptoms. For example, HIV is one. EBV. EBV is what is commonly known as Epstein-Barr virus or mono, can have longer-term symptoms. And there are quite a few other viruses that can, like the common one is herpes zoster. So people can get shingles from chickenpox, right? So there are many different ones. And I just want to pick up sort of what Dr. Chelios was talking about. We do know that there are other viruses like EBV, Epstein-Barr virus, that can predispose to MS, multiple sclerosis, which is a neurological autoimmune type of disease. So is it possible? Yes, it's possible. Do we know what the extent is? No, we don't. And I think it's too early to tell. But there are other precedents for this. Now, has coronavirus done this before? That's the part that we're not sure. And, you know, in the early days of this pandemic, when I asked all my virologist friends and my rheumatology friends, they often tell me that coronaviruses don't do this. So I think we're seeing something different in terms of coronaviruses.
Maybe Dr. Banerjee, you could follow up on that in this regard. If a lot of these things, these different viruses, present in the same way, how do you know what you're fighting?
Well, right now we've got a lot of coronavirus, and so, you know, just looking at the epidemiology plus, you know, a positive test. But there are certain unique characteristics of coronavirus and COVID that you don't see in EBV, like, you know, the shortness of breath, the myocarditis, you may have funny sensations or numbness or tingling in your hands. You may have loss of taste and smell. That's pretty unique to COVID. I mean, so it's hard to tell if someone just has general fatigue, but there's enough other symptoms, like we said, 200 symptoms, that you can say this is likely COVID. And often there's a history of exposure, but not always. So you put the pieces together, and nowadays the main virus right now is COVID.
All right, let me do this follow-up with you. Typically speaking, could you compare how long COVID-19 typically lasts in a long hauler with somebody who's suffering from Epstein-Barr virus?
So, you know, we don't really know how long it's going to last. I mean, the patients I've seen, again, 2 years. I had COVID March 16th. I didn't realize it until about 3-4 weeks later, and I can't smell, and I have chills in the middle of nowhere about 3 times a week, and I start shaking. So technically, I would be called, you know, long hauler, and I've had it for 2 years now. How long will COVID last? You know, I don't know. But a lot of the long hauler patients I've seen, I'd say half of the ones I eventually discharge. That most of them are not back to baseline, but a lot of them have improved enough to be functional. So, but the symptoms with EBV, again, it can last for a very long time, and it's more vague. But COVID is much more unique in the symptoms.
I just want to make sure I heard you properly there. You've been fighting, you've had COVID symptoms, you've been fighting COVID for 2 years?
I have some, it's not interfering with my work, but I have technically long hauler because of the thermo regulation. It could be 35 degrees out and I'll be shaking with goosebumps. And that happens about 3 times a week since COVID. So yes, I can work, I'm functional, and I don't even call myself a long hauler, but I do have symptoms, and it's occupational exposure. I work in tropical medicine. I saw someone off a cruise ship who had diarrhea at the first week of March, and there you go. We didn't know much about COVID at that time.
And are you doing anything in terms of medication to treat the symptoms that you've got?
No, it doesn't really interfere with my life.
Okay, well, that's 2 of us then who've had COVID-19. I guess I should ask the other 2. Dr. Chung, have you had it?
Not that I know of.
Not that you know of, okay. Because you may have had it and be asymptomatic and it didn't affect you, so on you go. Is that it?
I too had a viral illness. I work in this area, right? So, but it was PCR negative, so it's unclear.
So you had something, but you don't know that it was COVID-19. Mm-hmm. Got it. Okay, Dr. Chelios, how about you?
No, I didn't have anything for the moment. All my tests have been negative. I'm triple vaccinated. I hope when I contract the virus, because I believe that all of us will contract the virus at some point. I hope that this will be mild and they won't have any long persisting symptoms.
Now, Dr. Chelios, let me stay with you on this. I know some people who've got long COVID, and in their case, it's it's pretty debilitating. Constant headaches and really feeling miserable and not themselves going on many months now. Can you give any advice as to how those people might want to do something?
I'm seeing the same, Mr. Pekin, and I have to admit that we don't have any specific treatment since we don't know what exactly causes this long COVID. I'm seeing patients who, as I said, are on short-term disability or a leave of absence, and they are planning to ask for long-term disability because they just can't return to work. Now, what we advise in these patients actually, and what has been shown to help a bit, is conservative management with exercise and plenty of rest, a balanced diet, and all those things that will help you feel better. From the therapeutic perspective, we don't have treatments. We prescribe symptomatic treatments for the control of pain or to help them sleep better. But no, we don't have any specific targeted treatments for long COVID yet.
Dr. Chung, can I get your advice on that? What should these people do if they have it?
We advise patients to rest and pace themselves because that works. And when they are, so I tell patients that think of you have a pot of energy, and whether you are exerting your energy physically, cognitively, or emotionally, it's still the same pot. And so when you feel like a crash or really fatigued, you should really look back at the last few days to see what you have done. It's not just that day. And so then you learn where your threshold is and you stay under that threshold. So that's one thing that we teach patients. The second thing that we teach patients is doing breathing exercises. Slow, deep breath in, and slow, deep breath kind of slowly let it out. At the top of inhalation, you take a little bit more to expand. And when you breathe all the way out, you try to squeeze the last piece out at the end. And these breathing exercises not only strengthen your breathing muscles, but also can regulate sort of your autonomic system. And so those two things we do teach patients. And depending on what their symptoms are, we do sort of prescribe medications. So, if they are coughing we would prescribe steroid inhalers. If they are having headaches, we can give certain medications like gabapentin. So there are symptomatic treatments, as Dr. Chelios said.
Dr. Banerjee, I'm tempted right now just to take a moment and have us do those deep breathing exercises together, just in case it might be helpful. Oh, no, actually, we don't have enough time left to do that. So let's in our remaining moments here, let's focus on we understand what this is doing to individuals. I'd like a better understanding. Dr. Chelios, perhaps to you first on this. What's this doing to our healthcare system in general in terms of its ability to do what it does?
I think, Mr. Pekin, that long COVID will have a significant impact on the healthcare system in the very near future, or it already has an impact. We are estimating now more than 100,000 people in Canada with long COVID, and most of them at some point will need to have like a visit in the long COVID clinics and see what's happening. And I have the impression that these people are mostly middle-aged or young people. They are mostly women. They are mostly active professionally, and I think from what I'm saying, like 10 to 20% of these people will go on to long-term disability, and this will have like a huge impact on workforce and other expenses. And I don't even want to think about the burnout of the physicians in the long COVID clinics and in the COVID wards here in the hospitals, right? And I think that we have measures to protect our people, and like the vaccines, I think it's hugely important. I think we need to focus on that to avoid long COVID cases, to prevent these numbers.
Dr. Banerjee, is Ontario's healthcare system able to handle the requirements of treating 100,000 patients with long-term COVID?
I don't think so. Right now, we're on the cusp as it is. And I think that we're just seeing the tip of the iceberg. There's a lot of people that have symptoms that haven't yet been diagnosed or don't know that there actually is a long haul clinics. And so once those people start coming, because they have multiple health issues, the brain fog, they have neurological symptoms, cardiac symptoms, they have rapid heart rate, POTS syndrome, shortness of breath, so respiratory symptoms, joint symptoms. And again, it may be masking autoimmune disease. So there's going to be a lot of people in the next little while that are going to start surfacing with some conditions. And it may take a while to connect them back to COVID, especially if they didn't do a test or the test was negative, in fact, when they did have COVID. So I think that's going to be another major, it's going to have more impact on the healthcare system moving forward.
And Dr. Chung, just finally, is it obvious to say that if you are vaccinated, you're going to have less chance of becoming a long-haul recipient of COVID-19?
That's correct. And there are a couple of studies right now showing that if you get vaccinated, you have less severe symptoms and less long-haul symptoms.
Okay, good to know. I want to thank the three of you very much for coming on to TVO tonight and helping us out with this. This has been most instructive. From right to left, Dr. Constantine Chelios, Dr. Anna Banerjee, Dr. Angela Chung. All good wishes to the three of you. And if I may say, Dr. Banerjee, to you in particular, I really hope you get over your symptoms soon, because we need you working at 100%.
Thank you.
Thank you very much, you three.
Thank you so much.
Thank you.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.